Nearly everyone gets a headache at some point. But did you know there isn't just one kind? There are actually several distinct types, each with different causes, symptoms, and treatments. In this video, I'll break down the most common types of headaches, what triggers them, and importantly, the warning signs that mean it's time to see a doctor. Let's get into it. Let's start with the most common type, tension headaches. These affect up to 70% of people at some point. What it feels like: a dull, aching pain, often described like a tight band squeezing around the head. It usually affects both sides. Causes: stress, poor posture, eye strain, dehydration, or muscle tension in the neck and scalp. Typical treatment: over-the-counter pain relievers, stress management, hydration, and stretching. Next up, migraines, which are much more than just a bad headache. What it feels like: throbbing or pulsing pain, often paired with nausea, vomiting, and sensitivity to light and sound. Aura: some people experience an aura beforehand, visual disturbances like flashing lights or blind spots. Causes: genetics, hormonal changes, certain foods, stress, or sensory triggers like bright lights. Treatment ranges from OTC medication to prescription triptans, plus lifestyle and trigger management. Now for one of the most painful types, cluster headaches. These are rarer but intense. What it feels like: sudden, severe burning or piercing pain, usually around one eye. Attacks often happen in clusters over weeks, sometimes at the same time each day. Other symptoms: watery eyes, a droopy eyelid, or a stuffy nose on the affected side. Treatment: oxygen therapy and specific medications. This type usually needs a doctor's guidance. Sinus headaches are often confused with migraines or tension headaches. What it feels like: pressure and pain around the forehead, cheeks, and eyes, often worse when bending forward. Causes: sinus infections or inflammation, usually along with congestion, facial pressure, and sometimes fever. Treatment: treating the underlying sinus issue, decongestants, antihistamines, or antibiotics if it's a bacterial infection. Here's one people don't expect: headaches caused by the very medication meant to treat them. What it feels like: a daily or near daily headache that develops from overusing pain relievers. Causes: taking headache medication too frequently, often more than 2 to 3 times a week over time. Treatment: gradually stopping the overused medication under medical supervision. Finally, hormonal headaches, which many people experience around their menstrual cycle, pregnancy, or menopause. What it feels like: similar to migraines, often linked to fluctuating estrogen levels. Treatment: hormone therapy, lifestyle adjustments, or targeted migraine treatment depending on severity. Most headaches are harmless, but some symptoms need urgent attention. See a doctor immediately if you experience the worst headache of your life, sudden and severe; headache with confusion, slurred speech, or weakness; headache after a head injury; headache with fever, stiff neck, or rash; new headaches after age 50. These could signal something more serious, like a stroke or infection. To sum up general prevention tips: stay hydrated, manage stress, keep a consistent sleep schedule, track your triggers with a headache diary, don't overuse pain medication. That's a full breakdown of the major headache types. If you found this helpful, hit subscribe for more health breakdowns, and let me know in the comments which type you experience most. Stay well, and I'll see you in the next video.